So still on it, let's look at the electric conduction system of the heart. Let's see how the heart generates electric impulse by itself. The most pointed part of the heart is the apex. The most flattened part is the base. Here we have 4 pulmonary veins, but I'm using just one to represent them. Here is superior vena cava. This is inferior vena cava. We have the right atrium. We have the left atrium, right ventricle, left ventricle. We have the valve here we call tricuspid valve. We have another valve here we call bicuspid valve. We have another valve here, we call it atriopulmonary valve that connects to the pulmonary artery. We have this valve here also that we call aortic valve that connects to the aorta. The 2 valves can also be referred to as semilunar valve. So the pulmonary vein bring blood to the heart from the lungs, and the blood is highly saturated with oxygen because it comes from where? The lungs. The superior vena cava drains blood from the top part of the body to the heart. The inferior vena cava drains blood from the bottom part of the body to the heart. So the blood that enters here is less saturated with oxygen. Blood that enters here is highly saturated with oxygen. From here, the blood passes through the valve and enter the ventricle. From the ventricle, the blood passes through also this semilunar valve and enter here. The blood that is here is less saturated with oxygen. The blood from this pulmonary artery will flow to the lungs, where it will collect oxygen and become saturated and come back through the pulmonary vein to the heart. The circulation of blood from the heart to the lungs and back to the heart is called pulmonary circulation. The blood here that is highly saturated will enter here through the aorta. It will move to other parts of the body except the lungs. It will circulate. While moving to the body tissue, there will be exchange of gases. The blood will give out its oxygen while it will collect the carbon dioxide due to the body metabolism. Then the blood coming back contains less oxygen. It is less saturated with oxygen. It will come back here and the movement continues. Okay? So for the heart to beat, the heart has its own generator. Okay? Generator. We call it pacemaker. It generates its own impulse. The generator produces its own what? Electricity. So the pacemaker produces its own electric impulse. It is located at the right side of the heart, just close to the superior vena cava. Okay? Now, when you have your generator, remember you have the wire connected to your generator. Okay? So, the wire referred to as a pathway. The pathway goes like this. We have the 3 pathways. And they terminate, they converge at another node. While we have another branch that enters the left atrium. Okay? This node here is the main pacemaker, the main generator of electric impulse. What we call it is sinoatrial node. or you call it SA node. Why do we call it sinoatrial node? The sign there tells you the shape of the heartbeat. Heart beats to and fro, to and fro. Okay? Then atria tells you where it is located at the atrium. So we termed it sinoatrial node. And it is the main pacemaker, the main generator of electricity. It's a specialized intrinsic myocardial tissue that generates electric signal by itself. It's intrinsic. Okay? So when it generates it polarizes spontaneously, sending impulse continuously. Okay? So that the heartbeat will keep on moving. Then it has also little branches that enter to the cardiomyocytes of the atrium, the cells of the atrium. Okay, so when they enter the cells of the atrium, they cause the cells to contract. Imagine someone touching you with electric impulse, touching you with anything like current. You will do what? You have to make some movement. So that is exactly what happens here. Okay, when the electric impulse moves here, branches touch the cells of the atrium, they have to what? Contract, make a movement. So this bundle here is called Bachmann's bundle. Bachmann is the name of a person that studied about this bundle. It's called Bachmann's bundle. Now, the function of this AV node, this is called AV node. We call it, this node is here, we call atrioventricular node, or you call it AV node. Why do we call it atrioventricular node? It's because it's located at the atrium and ventricle. You can see where it's located. So we call it atrioventricular node. Okay? So the impulse that moves like this comes here to converge before it's now supplied to the ventricle. Okay? So this valve here, the valve here serves as an insulator, preventing electric impulse from moving down to the ventricle through the atrium. So it serves as an insulator, such that the only way electric impulse, can move to the ventricle is through here, through the septum, through this side, okay, from the AV node. So the AV node has a bundle that comes out, and the bundle is called bundle of His. His is the name of a person. Okay, so these are just the connection, how the heart is wired. So this bundle of His has two branches, and what we call the branches is, we call it just bundle branch. We have the left bundle branch, and we have the right bundle branch, and the branch continues through the ventricle. The bundle has projections. Okay, that we call Purkinje fiber. Call it Purkinje fibers. Okay, these Purkinje fibers innervate, or they connect to the muscles, to the cardiomyocytes of the ventricle. They connect to the cardiomyocytes. Cardiomyocytes means the cells of the heart, of the cardium. Cardium means heart. Okay, myo means muscle, cells. Sites means cells. So they connect to the cells of the ventricle. Okay, so Purkinje is the name of a person that studied about this fiber, this small fiber, and these are the cells. The cells are contractile. The cells can contract and relaxes. Okay, so that is how it continues. Now, this pathway between this node and this node, this pathway are sometimes called uh, antenodal pathway or antenodal tract. Okay, because of one node here and another node here. Okay, or sorry, internodal, not an internodal tract. Inter means between. Okay, it's called internodal tract. Okay, so that is how it works. Now remember that when an impulse is sent here, the impulse converges here. Okay, the first place to contract is at the atrium. The atrium contracts when impulse is sent to it. It contracts. Okay, then the impulse will enter here. The AV node delays the impulse. It delays it. Okay, so that when the atrium contracts, the blood here can enter here, while the ventricle has not contracted. Okay, so that the blood here can fill here. The atrium and the ventricle all know to contract at the same time. The contraction of the atrium will allow blood here to fill up here first before the ventricle can contract and the blood will leave the heart. So this AV prevents if this atrium and the ventricle to contract at the same rate, at the same time. Okay, it delays it with maybe 100 to 150 seconds before it can now contract. Okay, so from here the impulse passes and go supply to the cardiomyocytes. They will now contract. When they contract, the contraction will now force blood out. So we have also vagus nerve here. The vagus nerve from the brain, okay, supplies, innervates these nodes, supply to this node. What the vagus nerve does is, remember that the vagus nerve is not the main generator of the impulse that causes the heartbeat. No, what it does is, it is parasympathetic in nature. When you are at a relaxed period, when you are resting or whatever, it reduces the number of beats per minute produced by the heart. Okay, that is parasympathetic innervation. Okay, to reduce number of beats. So also we have a sympathetic innervation. That is when you are exercising, playing, working, doing whatever, your heartbeat is supposed to increase. Okay, this also helps to increase, pass information to increase it. Okay, so we have other methods by which the heartbeat can increase or decrease, like hormonal coordination. That can also, like adrenaline and non-adrenaline, that can increase the heartbeat as well. But we're not going there now. So that is how the heart functions in its electric conductivity.